Welcome to the kitchen at Dr. Bell's office. We're continuing our talk on diabetes, come on man, in Greenville, South Carolina. I was sitting here taking a break and I came across a very interesting article that certainly I think is worthy of being discussed. We're talking about some of the complications of diabetes. Just today it was announced that new rules for truck drivers as it relates to strokes will be enforced very, very soon. As you know, strokes can occur when you don't keep your diabetes under control. The American Heart Association tells us that there are about 800,000 strokes in the United States every year. A significant number of those strokes occur in African Americans. Many of those African Americans have diabetes and other risk factors that they very well may not be aware. About 500,000 strokes occur in the United States also. These strokes are referred to as TIAs, transient ischemic attack. In other words, these are just mini strokes that people can have and they don't even know that they are having them oftentimes. When they do realize that they are having them, they begin to lose their vision, they begin to lose their thought processes, and etc. The message that's trying to be portrayed is that it's better to be safe than sorry. New recommendations from the United States Department of Transportation Federal Motor Carrier Safety Administration is now recommending that if you should have a stroke and you are a commercial driver, you will be forced to sit out 1 year before you will get the opportunity to get your license back to drive. And of course the reason for this is very, very obvious, because if you should have a TIA, a mini stroke, or you should have the big one, then you are likely to be very, very deadly on the highway. So what they're going to do is they are going to make you wait for 1 year, and then they're going to make you undergo psychological testing, and you will also have to undergo some other challenges that will make it very, very difficult for you to get your license. The bottom line to this, man, is that it seems to me that if you are a commercial truck driver, it would be easier to prevent the stroke than to go into rehab to try to get your license back. Of course, I'm Dr. Thaddeus John Bell, Closing the Gap in Health Disparities, and I'm at the Come On Man Conference in Greenville, South Carolina.